And on to health matters this evening. Most oral health conditions are large preventable and can be treated in their early stages. But what is good oral hygiene? Now, to give us more details and to answer that question for us is Dr. Gunther Streit from the Coastal Dental Clinic. A very good evening, doctor. Thank you so much for joining us.
Thank you for having me here.
All right. Now, doctor, what is the importance of practicing good hygiene, and how frequent should one have dental visits?
Okay, that's quite a loaded question. So, having a good smile isn't just all what it is to be. It's not always the most important thing. It is an important thing, but not always the most important thing. Um, having good oral hygiene also affects the rest of your body. So we've got a thing called anachoresis, where it means if you've got a dental problem or dental disease, it's a theory where it can spread from your tooth to the rest of your body and so forth. So you can have many other conditions caused due to bad oral hygiene or oral conditions as well. So yeah, so things like low preterm birth weight is also a problem. Certain infections that can spread to the rest of your body and increase in inflammation. So one wants to stay. There's a little acronym SAS saying things such as sugar, alcohol, and smoking are the main. Those are the main things you want to stay away from. So decrease those items. Also, good. Visit your dentist. There's a rule of two. I love using my rule of two. So brush twice a day for 2 minutes, and go visit your dentist for regular checkups and cleaning twice a year.
So,
I think that sort of answers that, yeah.
Okay. Now, what causes tooth decay and how can it be treated? Apart from the sweets, the alcohol, and the smoking, what other causes are there? And also, how can it be treated?
So, tooth decay, let's start from the beginning. When you brush your teeth, right afterwards, you get pellicle formation on your clean teeth. That is now where plaque and that will start. So first plaque is a sticky, sort of colorless substance, and then it sort of transfers or matures into a tartar, more yellow-brown color sort of substance. Yeah. So you've got a buildup of a biofilm. So the biofilm consists of bacteria, and these little guys could elicit an immune response and cause problems as well. And yeah, so I think that answers everything, eh?
Right. Now, we still have people that experience having bad breath even after brushing their teeth on a regular. What causes bad breath?
Well, the bacteria and the biofilm that we just spoke about, these little guys, they sort of run rampant. So we need to brush your teeth. We need to floss every day just to keep these guys under control. Brush the tongue. Make sure that's also brushed. Also, diet is really, really important. Also, getting back to your previous question, we've got a little acronym also called, I think, GDP. Gingivitis, decay, periodontitis. So that is where people will start off with these biofilms. They will elicit an immune response. We'll get swelling of the gums, the bleeding, the soreness happening. That will progress to periodontitis. But remember, not everyone with gingivitis will get periodontitis. Periodontitis is only when we have a destruction of the bone, the supporting tissue around the teeth. So I can go on for days on this, but that's yeah. So how do we lose bone around our teeth? There's certain structures in our bone. They're called osteoclasts, and the osteoclasts don't like the infection that's happening around the gums. So they try and protect the body by eating away the bone and pulling away from the infection, and that's why we start seeing the sensations, the sore gums, even tooth loss after that.
Right now, doctor, unfortunately, we are running out of time. Perhaps you could just give our viewers a few tips on oral hygiene, and also maybe just some of the food stuff that can, that they can stay away that is not good for the teeth.
Sugar.
Sugar.
Yeah, sugar, refined carbohydrates. Keep to eating healthy vegetables and drinking loads of water. Fluoridated water is really important. I mean, that actually gets placed into our daily water supply at NAM Water. And for instance, Swakopmund has ideal water fluoridation. We've actually looked into this with having a chat with them as well. Also, stay away from the SAS, your sugars, your alcohol, and your smoking as well. And of course, brush daily. Twice a day, rule of two.
All
I
right,
think that's a take-home message.
Yes, doctor, thank you so much for that.
Thank you for having
And we
me.
wish you all the best with the rest of your day.
Thank you so much.
All right.